Okay, broken teeth. These are fairly common. I get to see about, I don't know, 2, 3, 4 a week in a busy week. The horse's tooth isn't like a human tooth. It's made up in layers from hard surface on the outside, followed by a softer surface or layer, and then a harder layer, and then a softer layer. Kind of like the layers of an onion. And sometimes, for whatever reason, whether the dynamics of the chewing motion or a little bit of a cavity forms in there, or there's the genetic predisposition, or all a combination of three, there's a weakness that comes into that tooth and it splits. And I usually see slab fractures, which look like just a layer of the tooth has been pushed off and cracks off right at the gum layer. And oftentimes I get there and it's an incidental finding. Sometimes I'm called out because those little pieces have gone actually into the cheek or the tongue, and it creates a lot of pain, and the horse is salivating a lot or having a lot of saliva, having difficulty chewing, cocking his head off to one side, doing whatever. Now those horses usually do very well once the tooth is extracted and the edges are filed down so the tongue can get in there and keep the socket cleaned out. But until then, it can be sometimes frustrating for a horse. But again, oftentimes it's an incidental finding that the owner doesn't even know that there's a problem with the horse. So tooth extractions are fairly simple. Extractions of whole teeth I rarely do because there's too many complications. I know there's a lot of dentists out there who are using spreaders, and they loosen the tooth in the socket and then they extract it, and they've become very successful at it, but there's always a danger of breaking a piece off, and as you break a piece off, it leaves a source of infection, which is probably the reason why you're pulling the tooth out. So I always refer these horses to surgery to extract. Now, that said, a lot of these broken teeth aren't causing any problems in the horse, and yet they're so large that they're very difficult to get out, and the owner doesn't want to take the horse out of training or go through the surgery process. And what I usually tell them is, if it's not a problem for eating, it's not a problem for bitting, then leave it and wait until it matures. In other words, wait till the natural process of rejection occurs, and it helps push that tooth up to an area where I can grab hold of it and easily extract it without fracturing off a piece under the gum. And most owners are willing to go along with that. Sometimes they put them on tribrissin for a while, just try and clear up the infection. But a lot of times I can just get in there maybe a year and a half later and finally work the tooth loose and get it out. So time's on our side. We don't have to be jumping in and doing anything dramatic. We just have to take care of the horse and listen to what they're saying. So that's broken teeth and tooth extraction.